Hello everybody, and welcome to your 2012-2013 Recert process. So we're going to be talking about intramuscular injections today, and then there's going to be a short video after with Stéphanie Romano and Dr. Paul Bradford taking you through step by step how to do an intramuscular injection. So what are our objectives today? When we're done this, when we complete this online training module, all paramedics should be able to identify the indications for the use of an intramuscular injection, as well as describe the proper administration of an IM injection itself, the actual process of doing it. So what are our indications for use? An intramuscular injection is used when we can't give medications orally. Penetrates the epidermis, the dermal tissue, down to the subcutaneous layer, and then into the musculature itself. This route is used for, as I said once before, when drugs can't be given orally, and a more rapid onset of action is desired of the drug. Or, the third thing is if it's too irritating to be given subcutaneously. More blood flows to the muscles than it does into subcutaneous layer, therefore allowing for a quicker absorption process. So what are our contraindications for use? Essentially, inexperience from the medic themselves if they are not trained in how to give an intramuscular injection, pain, injury, infection, or fracture at the injection site. Obviously, we want to stay away from those areas. And then another one called coagulopathy. And what that is, a low platelet count of less than 50 is a contraindication for IM injections. And don't risk giving the patient a hematoma that is sometimes painful and can be actually limb-threatening. So what's required for our intramuscular injections? We'll obviously need our syringe itself with our intramuscular needle attached, the appropriate medication you'll be administering, have your sharps container always readily available, your alcohol swab, your gauze pads, band-aids if necessary, and always remember to have gloves on. PPE is important. So our IM injection sites. So the first thing we want to do is select the needle appropriate for the IM injection site. So the needle should be long enough to get into the middle of the muscle, to the core of the muscle. The gauge of the needle depends on basically the viscosity or the thickness of the medication that's going to be injected. Usually around a 19 to 23 gauge needle is used for majority of IM injections. 1 to 2 inch needles are used for most adults, and usually a 1 inch needle is utilized for thinner adults, and the 2 inch needle is for the heavier adults. So the needle it will be inserted at 90 degrees into the muscle. So there's many different sites we can use for an IM injection. The main site we'll be using is the deltoid. We also have the vastus lateralis, which is the muscle on the outside of the thigh. We have the ventrogluteal muscle, which is at the upper forward portion of the buttock area, and the dorsogluteal, which is the upper outer quadrant of the buttock area, the gluteal area. Just remember that an adult can give up to have 5 mils of injected medication at one site comfortably, depending on the size of the muscle. In a child, about 2 milliliters is the maximum that can be tolerated per site. You're going to see now Stéphanie Romano and Dr. Paul Bradford, and they're going to show you how to give an IM injection throughout a video. Thank you.
Hi, we're here talking about IM injections, and I'm Paul Bradford, ER physician from Hotel Dieu in Windsor.
And I'm Stéphanie Romano, one of your regional paramedic educators.
So you may be asked to deliver an IM injection to a patient, and it's important that you have the appropriate personal protective equipment that you're wearing, and also look at the indications as to what you're going to be injecting. And in our situation, the spots to look for would be the deltoid area, and if that was not accessible, then the upper outer gluteal area would be the appropriate place.
Great, so the first step is to make sure that you have all of your equipment ready. So in this case I have an IM needle. This one happens to be 3 milliliter needle, 25 millimeters in length, and a 25 gauge. So I want to make sure that I have the appropriate IM needle. I want to make sure I have some alcohol swabs to cleanse the site, as well as the appropriate medication for that patient. Also need to make sure you have your sharps container close. So in terms of measuring the site, Dr. Bradford, how do you recommend we measure for the appropriate injection site?
So you want to go down 3 centimeters from the chromium into the deltoid area. And we also want to warn the patient, we're going to be sticking you with a needle right now.
Perfect. So we've done that. So I'm going to cleanse the site, again in a circular motion, moving outwards approximately 2 inches, and letting the area dry on its own. So we're not blowing on the area to make it dry. So at this point, I'm going to get my medication ready. So of course, check your medication for integrity, for expiry date, correct dosage, and check with your partner as well. I'm going to cleanse the top of the vial. Of course, say sharps out. And so at this point, I'm going to actually inject a volume of air into the vial to create a little bit of negative pressure, and then withdraw the appropriate dose. So let's say in this case, I'm going to withdraw 0.5 milliliters of whatever medication this is. So sharp out again. So at this point, in order to inject the medication into the deltoid, you want to make sure that for an IM injection, to pull the skin taut. So I'm pulling the skin away from itself, and in a darting motion, 90-degree angle, inject into the deltoid. So at this point, I want to aspirate for blood. I don't have any blood here, but Dr. Bradford, if I did have blood, what would you recommend I do?
Push this, no, that's wrong. I would pull it out, because that means you're in a vessel, which means it could be an IV or intra-arterial injection, which may be wrong if you're dealing with certain medications sclerosing to the vein, or also causing spasm of the artery. And that would be a medication interaction and a negative event. So we wouldn't want to inject in that situation.
Perfect. So in that case, I would withdraw the needle and start all over again. But in this case, I did not have any blood, so I'm going to inject the fluid slowly, retract my needle, dispose of in the sharps container, and massage the area for the patient. And of course, observe the area thereafter for any type of swelling, redness, or pain.
And then we document the procedure in our appropriate medical record.
Great. And so that's how you administer an IM injection.